Hi, my name is McKynnsi. I'll be your nurse today. I'm going to be doing a head-to-toe assessment with you.
Okay.
Thank you for coming in, and how are you doing today?
I'm doing good. How are you?
I'm good, thank you for asking. Can I have your name and your date of birth?
Caitlin, it's 12/20/03.
Okay, and do you know how old you are?
I'm 19.
Alright, and do you know what today is?
Today is Tuesday the 10th.
Okay, and do you know any special holiday coming up?
Halloween.
Halloween? Okay. So my patient has the 3 spears, person, place, or time, shows no signs of distress. Her conscious level is alert as she's responding to stimuli. Her appearance from my visual is in good measures. She's dressed for the weather. Her hair is done nice, and I don't smell any odors, so her hygiene's done well. She explained that she's in no distress, so that is good. Okay, so now I'm going to move on to the assessment. I'm going to do your eyes real quick, okay? So I'm going to shine the light into your eye. I just need you to look towards my way. Okay, ready? Okay, I just did the direct response. Both pupils, when reacted to the light, they dilated. Next, I'm going to do consensual. So I'm going to have you do the same thing as you did, okay? Okay, and also for consensual, it was apparent that whenever you shine the light, the other eye also responds in dilations on both sides. Next, I'm going to have you look at the pen. I'm going to follow it to your nose. Just like go with the flow, okay?
Okay.
Go.
Sorry, boy.
The eyes did go together for the convergence. And next for accommodation, I'm going to have you look at the pen, and whenever I tell you to, look beyond my shoulder, okay?
Okay.
Go ahead. Alright. And pupils also did dilate to accommodate for the distance. And with the given light, her resting pupil is about a 4. Okay? Patient does have parella, meaning that she has round, equal light reaction and or reaction to light and accommodation. Next, we are going to do your nose. Okay, so I'm going to have you look up for me. Or first, actually, can I have you plug each side and do deep breathing for me? Okay, thank you. And now I'm going to look up your nose. Okay, and while we're here, can I have you open your mouth and stick out your tongue? Very well. Okay, so the patient mucous membranes are pink and moist. Her nares were pink and moist as well as her membranes. Her septum was in medial, so there's no deviation. Her mouth was in good condition. There was no tours of the gums or anything, and the cheeks. Her teeth were very pretty and groomed. No teeth decaying of any sorts. Next, I'm going to check your swallowing, okay? So I'm going to place my hands on your trachea. Alright, and you can go ahead and swallow for me. Thank you. That's a little hard, huh?
It's a little dry.
Okay, and while we're on the topic of speaking, the patient has gross motoring. She's able to respond to me. She understands what I'm saying. She communicates in full sentences, English, holds eye contact, the clear tone. I'm going to step behind you. I'm going to whisper something to you, and I'm going to have you repeat it to me.
Can't say test.
Okay, fine motor is also apparent. Moving on, I'm going to do your lymph nodes. So, put some hand sanitizer for you. Okay, and first I'm going to do your third one. Preauricular, post-auricular, post-cervical, occipital, anterior cervical, supraclavicle. I'm going to do your submandible and submental. Okay. All lymphoids were non-palpable, which is good because that means if there was any swelling of any sorts, there would be signs of infection, and we do not want that. Next, we are going to move on to your gag reflex. Back with your tongue. Gonna shine the light out. Stick out your tongue for me. Okay, very good. The patient's gag reflex contracted, meaning that it's in good condition and that if anything, she won't be able to choke on food and it will help with that. Next, we're going to do your vision for me. So we already did she has Perella. I'm gonna have you hold this 14 inches out with straight arms and you tell me which where you can read to.
Second to last line.
Okay. Okay, so the patient sees 20 to 25, meaning that what the patient sees at 20 feet, a person with normal vision of 20/20 can see at 25 feet. Next, we are going to do your palatal reflex. I'm going to go down to your knees. I'm going to hit right here on your tendon and just go with whatever motion that your leg involuntary does, okay?
Okay.
Okay. Alright. Patient's palatal reflex was in good condition, rating it as a 2, as it wasn't hyperactive. It was an average means, and it was not a 0, meaning that there was absence of it. So next, I'm going to do your pull summary. So can I have your fingers, please? I'm going to place this on your finger. And this just explains the amount of oxygen in your blood for all the tissues that you have. So you have a 100. Nope, sorry, 98. 98% of your SpO2. Can I see your hands again for me, please? I'm going to check your capillary refill. Right, that's our capillary refill in her hands is less than 3 seconds, which is normal findings. And check your toes. Again, there was normal findings for it was less than 3 seconds for the capillary refill. While I'm down here, I'm going to check your legs for edema. There's no swelling, so that means that the edema is not there. There's no pitting and nothing, but if there was, it would be measured by the depth of it through 0 to 4. We'll check this leg too, just to make sure. Yep. Okay. Can I have you bring your toes to your nose? All right. And you press the gas pedal for me. All right. Very well. All right. And the strength for as I was down there, I did her strength for her feet to nose to toes, and then pressing the gas pedal. Both feet were equally strong. Next, I'm gonna have you squeeze my fingers. Okay. Oh my God, your hands are really hot. Okay. I'm gonna have you pull me. Okay. And I'm gonna have you push me. Okay. So her pull and push was also very strong. Her grip was also strong and normal for her findings. All right. Next, I'm gonna look at your skin as I've been observing it as of now. Her skin looks to be within her given race as the color. It is warm to touch, even down by her legs as I assess her edema. Her lower extremities are warm. Her toes were cold though, I will say that, but she does have her socks off, so her skin's in good condition. Looks moisturized, meaning hydration is involved. Next, going on with skin, I'm going to do your sensation. So I have a cotton ball and this little, it's like one of the toothpicks that are like thin. I'm going to brush it against your skin and you tell me if you have, if it's light or hard and where it's located, okay?
Okay.
So I'm going to have you close your eyes.
Right arm sharp.
Okay.
Left arm soft. Left cheek hard. Forehead soft.
All right, so her sensation is intact. She was able to feel both sharp and soft. Next, I'm going to do your pulses. So I'm going to do your shoreline which you do separate, or you can injure someone. Can I have you push your arms out for me? Okay, do your brachial, radial, femoral, oblique, posterior, posterior tibia, and your dorsal pubis. All right. Don't make feet. Sorry, nothing's against you. So next, I'm gonna listen to your heart sounds. Make sure it's good in there. Okay. So I'm gonna have you sit up straight for me. Gonna listen to your Gonna listen to your aorta, your palmic, your herbs, tricuspid, mitral, which is also the apical. So listening, I found that it was in irregular meanings, so it was be a +2 for her pulse on her heart. Listening to the with the stethoscope, I used the diaphragm, which is for high-pitched sounds, but you could also use the bell, which you can listen for low-pitched sounds, for like listening to a heart murmur or anything. Her S1 and S2, we're not there yet. Just kidding. Okay, so next I'm going to listen to your respiratory. I'm going to have you take deep breaths. I'm going to start over here. So, deep breath. And then I'm just going to go in position so you can relax. Have you lift your arms up like an Egyptian. Thank you. Great. And I'm going to have you turn around for me. Get back, and then I need you to give yourself a big old hug. Patient's respiratory was very clear. There was no sounds of wheezing, any cracklings of anything. It was very clear. Her respiratory is unlabored and easy, and it was equal rise and fall. Going back to her cardiovascular, I did miss the S1 and S2 sounds, which was lub-dub, and I did hear that it was clear and that there was no issues, and that if I did hear an S3, it would be a heart murmur, which we would listen to with our bell, and it sounds like a swishing. Okay, and let's go ahead and have you lie down, and we're going to do your abdominal. All right, and have you been having any pain, any tenderness?
No.
Nope. Okay, so just visually seeing it, her stomach is flat. It's not distended. It's in the right size for her body frame and her BMI. So I'm going to go ahead and listen first, starting in the right lower coordinate. Okay. So I did hear gurgles and cracks in her stomach, which is a good sign for digestion and activity in the abdomen. If there was no sounds, we would listen for 5 minutes to and then determine if it's absent or not. I'm going to go in the same areas that I was, and I'm going to do circular motions. Please tell me if you feel any tenderness or any pain, and we can go from there, okay? Okay. Stomach was soft and not firm at all. It's in good condition. You can go ahead and rise for me. All right, and when was your last bowel movement?
Yesterday.
Yesterday? And on regularity, when is that? Like, how many times a day do you say?
Once or twice.
Once or twice? Okay, and what is the color?
Brown.
Brown. And Is it soft, firm?
Firm.
Firm? Okay. And for whenever you go to the bathroom and urine, what is the color for that?
Pale yellow.
Pale yellow? Yellow. And how many times would you say you go to the bathroom?
5 or 6.
And the clarity, is it clear, cloudy?
It's clear.
Clear? Okay. I think the only thing that I need you to do now is to, we're gonna do your range of motion. So I'm gonna have you come over here for me. I'm gonna have you, raise your hands. Arm circles. I'm gonna have you do a little penguin, so spread your legs out. A little soccer kick. Do a march. Hold it. There you go. March. All right. And can I have you walk to the wall and back?
Mm-hmm.
All right. Very good. And can I have you sit down again for me? Patient has full. Oh, actually, one more thing you can do is while you're sitting. Can I have you look up and down, and to the green plant, and then to the window? All right. Now I finished her range of motion. It isn't, she's able to move. There's no obligations of any sort. Her gait was strong and steady. And one more thing, I'm gonna do your facial symmetry. So can I have you stick out your tongue? Okay. Can I have you smile? Frown. Puff your cheeks out. And raise your eyebrows. Nice. There was no signs of drooping of any sorts. Facial symmetry was equal. And I think that's all I have for you today. Thank you for coming in. Do you have any questions for me?
No.
No? Okay. I hope you have a good rest of your day. Thank you.
Thanks, you too.